What is liposuction?
Liposuction is a very popular cosmetic surgery procedure, and we perform a lot of it here at the Plastic Surgery Center of Tampa. But in general, long cannulas are used through tiny incisions in the skin, and they're used to literally suction the fat out of the body, and resulting in a permanent reduction in fat.
I've heard it's a popular procedure. Is it popular?
Yeah, it's one of the most popular. In fact, it's probably the most popular that we do here. But I think overall national results, liposuction, breast augmentation, and rhinoplasty or a nose job are always the three most popular procedures. Of course, not everybody is a great candidate for liposuction. People that are still in the process of losing weight, generally you would want them to lose all of their weight before they proceed with surgery. And like any elective surgery, patients need to be healthy and capable of withstanding the surgery. So no diabetes, no heart disease, no lung disease, no blood clotting disorders. Just a general healthy patient.
Is liposuction a good substitute for diet and exercise?
No, not really. Liposuction isn't a good substitute for diet and exercise. It's not a procedure for weight loss. It's a procedure for body contouring. So the best patients, or the best candidate for liposuction, is a patient who's at or near their ideal body weight, maybe up or down a few pounds, but has areas of fat, for women usually on the thighs, or for men oftentimes on the trunk, that are resistant to diet and exercise, just those stubborn areas that you can't seem to get rid of. It's for fine sculpting of the body, not general weight loss.
So can liposuction get rid of cellulite? Every woman has it.
No, unfortunately. While liposuction can usually cure most people of almost all of their unwanted fat, unfortunately cellulite can't be corrected with liposuction. Because cellulite is caused by the fibrous septae between the underlying fascia of the body and the skin. So oftentimes if you do liposuction, you can sometimes maybe reduce the appearance of cellulite, sometimes even make it worse, but you can't get rid of it.
So what procedures do you use for liposuction? What's involved?
Here at the Plastic Surgery Center of Tampa, we do mostly your standard Tumescent liposuction and power-assisted liposuction. Tumescent liposuction is the standard liposuction that almost everybody uses, where you infiltrate the area to be liposuction with a little fluid, and then with the use of a cannula powered to a vacuum, you physically remove the fat. Power-assisted liposuction is similar, only the cannula that we use is hooked up to a motor so that it vibrates and makes the removal of fat a little bit easier for the surgeon and a little gentler to the patient. And I'm sure patients out there listening have also heard of many, many different kinds of liposuction, including water liposuction and laser liposuction and ultrasound liposuction. But really, all of those are just the same. The laser, the water, the ultrasound, the power, the surgeon-assisted liposuction. The only thing that does is break up the fat. But you still need to physically remove the fat from the body with the liposuction hooked up to the vacuum.
What type of anesthesia do you use?
Here we do body sculpting liposuction. So we do a fairly aggressive liposuction, whether that be liposuction alone, Brazilian butt lift, which also includes liposuction, or abdominoplasty, in which we do liposuction. So usually those procedures are performed under general anesthesia, meaning the patient has a breathing tube in their mouth and they're completely asleep during the procedure. Occasionally, if we have small areas of liposuction, or we're doing a touch-up on one of our previous patients, we might do that under a local anesthesia with a little IV sedation.
Dr. Temmen, is liposuction permanent?
Yeah, liposuction is permanent. I'm sure that most people have heard that if you have liposuction, well, the fat just shifts around and you'll gain weight in other areas of the body. In fact, my sisters convinced me, or were convinced, that was true. But that isn't true. When you do liposuction, you physically remove fat cells from the area of body to which liposuction was performed. If after liposuction the patient gains weight, they will continue to gain weight throughout the body, but just not have a predilection to gain it in the area where the liposuction was performed.
So what's recovery like?
Recovery, like most of our procedures, I'll just start from the beginning. The patient goes home the day of surgery. It's an outpatient procedure. I see all my patients the day after surgery to make sure they're feeling good and happy and walking around. Drains, if they're used, will come out in about 5 to 7 days. The patient wears garments, a compression garment, to help with healing and shaping the body for 6 weeks. And most patients are able to return to work after 3 days, 4 days.